Today and every day, 1,700 babies are born in the flood-affected areas. Around 250 of them will experience complications. The UN estimates 500,000 women will give birth in the flood-affected zones in the next 6 months. Those that make it to the camps are relatively lucky. They should get some medical assistance. Others are still wading in the water with no access to even basic healthcare, the unseen and the unlucky. Our cameras followed the Pakistan Medical Association, which has set up tents in the camps they can get to. A midwife monitors the pregnancies and keeps a check on the women. Amira Nissa is having her 7th child. She's anemic and a high-risk patient.
कि एक तो इनकी लास्ट डिलीवरी जो हुई है उसके बाद इनकी ये कंप्लेन है कि इनको ये पीपीएच में गई, यानी कि बहुत ज़्यादा खून गया है जिसकी वजह से हॉस्पिटल एडमिट भी हो गई थी। दूसरी बात ये है कि अब ये जल्दी कंसीव कर लिया 1 साल के अंदर, अभी बच्चा मेरे हाल में इनका 1 साल सवा साल का है तो कंसीव हो गई है। अब इनकी अगर हम देखें तो इनको हमें देखने से ही अंदाज़ा हो रहा है कि ये बहुत ज़्यादा एनीमिक है इस वक्त ये पेशेंट।
फिक्र तो हुआ, बहुत फिक्र हुआ। मैं रोई थी, मेरे पेट से बच्चा है। यहाँ पे तकलीफ़ है, बहुत तकलीफ़ है। पानी पीने के साफ नहीं है, कुछ भी नहीं, सहूलत नहीं है, कुछ भी हमारे पास यहाँ। नीचे सो रहे बच्चे, बार बार बीमार होते, दवाई लेके आते, फिर वो उसको कोई फ़ायदा नहीं होता दवाइयों से।
Nadia is refusing to drink milk.
नहीं पीती। तो देखो हमल से हो, हमल के अलावा बेशक दूध तुम्हें अच्छा नहीं लगता, नहीं पियो, लेकिन हमल में तो तुम्हारे और तुम्हारे बच्चे को ज़्यादा ज़रूरत है इस चीज़।
The midwife struggles to convince her that it's good for her health and her babies.
तो कोई चीज़ भी इसमें डाल दो, रूह अफ़ज़ा डाल लो, ये कोई और चीज़ भी इसमें डाल के मिक्स करके चीनी डाल के पी लो।
We found that language is a huge problem in the camps. Pakistan's diverse population speak many different languages and dialects. Children often bridge the communication gap.
ना इससे पूछो ये कहाँ जाएगी।
This woman had had a high temperature for days, but hadn't alerted the midwife. Some women are scared they'll have to pay for the treatment. Others, like this one, had not thought it necessary. One of the major problems affecting safe childbirth in Pakistan is the delay in calling for medical help. Women and young girls deliver at home. The doctor is often only called once the situation is life-threatening or it's too late.
The main risk is hemorrhage, bleeding. This is the biggest risk because these women are already weak. When you say hemoglobin of 6, this woman, if this woman is in England and America, she will be admitted in the hospital and will be having intensive care. 6 hemoglobin is like that. So whenever this woman will deliver, she is very high risk as far as her death is concerned, because if she will bleed little bit and then she will start bleeding. So this is one of the major risks. The other risk is infection.
मथे तो नहीं कोठे ते चढ़ी वेठा आया से पोइ फ़ौज आई उन्हनि कढियो ॿेड़नि ते। हिकिड़ो ॾींहुं शाम जो आयो, पोइ सुबुह जो कढियो। जॾहिं आयूं लाचां आया, टपा टाड़ी भी कुझु न खणी आया आहियूं, सभु पुसी विया। 8 महीनो मूंखे पेट हुयो, मुझे सम्झ न आ रही थी, मैं बेहोश हो गई थी।
While we were filming, Fatima was taken to hospital. A high-risk patient, she gave birth to a healthy baby girl. Had she still been in her village, things may have been different.
अब के नहीं, न घर न घाट न रहाश न खाधो न पीतो, काई शइ न आहे। कुझु त हुजनि, माण्हू काथे वेहे न वञे। हाणे ख़ैर सां 8 बचा थिया।
Maternal mortality is still high in Pakistan, far from the Millennium Development Goals. Even before the flooding, for every 100,000 births, an estimated 500 women die. The flooding has only added to this grim situation. Trauma, lack of hygiene and sanitation, little food leading to malnutrition make women and their newborn babies more vulnerable.
These conditions are totally unhygienic. The water is not there, and whatever water they have, it's totally polluted and dirty water, and that will give you infection.
The camps are dirty and dusty. Many women give birth on the hot, sandy earth. The discomfort is secondary to the grime and dirt around them. People from rural communities, many illiterate or unschooled, have little or no training in hygiene. We found feces and urine just outside tents and even in the hallways of schools converted into camps.
There's no hygiene, there's no sanitation, there's no clean water, and in this situation, managing a pregnant woman is really difficult. It's really difficult.
ज़्यादातर बीमार होने की वजह भी यही है कि गंदगी है, मट्टी में बैठे, गंदा पानी है, पानी नहीं आ रहा। अभी कह रहे 2 दिन से पानी नहीं आ रहा। हाथ इनके इतने ज़्यादा गंदे होते, छोटे बच्चों को देखते तो नीचे हाथ मारे तो वही मुंह में जा रहा होता है, तो दूसरे दिन डायरिया के साथ आ जाएंगे। पीड्स देखे ना आगे, पीड्स देखे इतने सारे आ गए बच्चे।
Nagina holds a regular clinic, often crammed and overwhelmed. Midwives end up having to treat women and children for all kinds of problems: coughs and colds, diarrhea, fever, breast lumps, and sexually transmitted infections. Medicines are rationed and limited to 1 or 2 days' worth of doses. The lack of literacy and understanding means patients can't treat themselves. Perpetually pregnant, women are having one birth after another, some giving birth to up to 10 children or more. In a few years' time, the midwife told me, this young girl will be pregnant too. But women have little knowledge of how best to feed their babies and protect them from disease.
Newborn babies are again at the same risk of infection because most of them will be breastfed, but still the mothers are weak, and traditionally they will get some water from the family. They used to give things other than the breast milk, and that will cause infection. So that's the reason we have very high infant mortality rate, high perinatal mortality rate. That's the reason.
Babies lie in the hot sun with little shelter. The tents, hotter than an incubator, become unbearable. This woman had had twins. She was struggling to breastfeed them. Their sallow and sunken faces revealed the onset of malnutrition. Many of these women have never seen a doctor. The Pakistan Medical Association says there is a positive side to this disaster.
These pregnant populations are living in villages, far remote areas, in a very, very bad health care system. Like they don't have midwives, no doctors, no maternity home, and nothing. And suddenly there is a flood. So they all have to leave their village and come to the different camps in cities. And in cities, they are having far better care as far as their pregnancy is concerned, because some midwives are there, doctors are there.
The flooding has brought to light many issues Pakistan's people were already facing, now exacerbated by the dire situation. At least 20 million people have been affected by the flooding. Another 500,000 newborns will be added onto that number in the next 6 months. The plight of Pakistan's flood victims, old, young and new, is far from over.